Hello. Ever since the internet has made its advent into our lives, the medical nomenclature is one thing which has become extremely accessible to everybody. So, everybody comes into my clinic, or in fact, any clinic, with some background which they've acquired from the internet, and then they start speaking about it with that in the background. So let me try and help you with that. So there are certain medical nomenclatures which is very commonly used in our reports, and then which you again read up on the internet without having an understanding about what it is. So as far as the spine goes, I'll try and give you some very basic understanding about what each of those terms really mean. So when we look at the spine, so देखेंगे कि at the top there are 7 vertebrae. So they are the cervical vertebrae, or the vertebrae which is forming your neck. हमारी गर्दन बनाती है ये, तो लगभग इनफैक्ट लगभग नहीं exactly 7 vertebrae होते हैं. They are the cervical vertebrae. So short for cervical is C. And then you have a nomenclature after that, C1, C2, C3, C4, C5, going all the way up to 7. So each of those numbers signify each of those vertebrae. So C1 is the first, or the atlas vertebra. C2 would be the axis. C3, C4 would be the third, fourth, fifth, sixth, seventh cervical vertebra. Then we go down further. It does not become 8, 9, 10, 11. In fact, from there it becomes a dorsal vertebrae, or what we also call it as the thoracic vertebrae. So there are 12 of them, T1 or D1 to D12. After that comes the lumbar vertebrae, or the lower back. They consist of 5 vertebrae typically, L1, that's lumbar 1, to lumbar 5, L1, 2, 3, 4, 5. Finally, the lumbar vertebrae articulate with the sacrum. And now the sacrum consists of 5 bones which are fused together. So it's S1 to S5, but they're fused into one single triangular or pyramidal shaped bone. So that's the sacrum. And finally you have the tailbone, which is again a fusion of 2 or 3 coccygeal bones. So you have 3 approximately bones which form the coccyx. So this is how the spine is made: C, D, L and S. Another interesting facet would be where you could have an extra spine, एक ज़्यादा spine कोई लोगों में होता है, especially in the lumbar region. So that is actually derived from the sacrum. Sacrum का ऊपर का हिस्सा कट के lumbar spine बन जाता है. So that is called lumbarization of the sacral spine. So a part of the sacrum has become a lumbar. So in these patients you have 6 lumbar spines. Similarly, there could be some patients in which you have one spine, or the lumbar spine, which is less. In that, what has happened is वो lumbar spine sacrum में जाके जुड़ गई होती है, or that lumbar spine has fused with the sacrum. So you would, and that is called as sacralization of the lumbar spine. So उसमें L1, 2, 3, 4 होता है, and the 5th one is again like a sacrum. So when you count it, you will only find 4 of them. So again, very important, because at times when you would look into the image, even people actually look at the images, देखोगे और गिनोगे तो you might find one spine less. So there are certain technical terms which we keep using. And the other most important thing from your point of view, when a doctor asks you, what is the problem that you have? I have seen patients come and tell me L4, L5 में problem है. I've seen that. Now that's because you've read the report and come. We are not concerned about what is there in the report as far as your complaints go. We want to know आपको दिक्कत क्या है. Back में pain है, चलने में दिक्कत हो रही है. So we are more interested in that. The correlation between the two, between what we have on the MRI and what we have in the patient, will be decided by us, and based on a combination of these two things. जब clinical symptoms को और MRI में जो रिपोर्ट में जो दिक्कतें दिखाई दी थी उसको जोड़ा जाए, तब जाके वी आर एबल टू रीच अ कंसेंसस, तब जाके हमें पता चलती है कि एग्जैक्टली ये प्रॉब्लम है और इसका ट्रीटमेंट इस तरह से होनी चाहिए. So that is it about the numbering of the spine. I will have one more video which would maybe talk more about the other aspects of the spine and the diseases of the spine and what maybe you should know in my coming few videos. Thank you.